Hello, everyone, and thank you so much for joining us for the August's Ask the Expert. For those of you who don't know me, my name is Paula Hanford, and I am the CEO of PSC Support. This webinar was due to take place some time ago, but we had to cancel right at the last minute, so I'm absolutely delighted to be able to bring it to you today. I am joined by Dr. Lucy Gorvin, who is a clinical psychologist at the Royal Free Hospital in London. Dr. Gorvin has spoken at our information day. The session was really good. We had some fantastic feedback on that. And Dr. Gorvin specialises in working with patients who are undergoing a liver transplant. But she's presenting today on managing the psychological impact of PSC, which we know it's a very important for people with for people with PSC. And there will be time for questions later on in the webinar. I'm also joined today by Mark Chatterley, who is PSC Support's Administration Manager. Mark is running things in the background, and I wanted to say thank you so much for that, Mark, for doing that. We have 89 people signed up for the webinar today, which is amazing considering it's August and there's lots of people on holiday, but I think that just shows the importance of the topic for people with PSC. So let's crack on. Dr. Gorvin, or Lucy, you told me to call you Lucy. Thank you so much for giving up your time this afternoon, and I will hand over to you.
Thank you, and thank you for that kind introduction, Paula. So as Paula introduced me, I'm a psychologist working with liver transplant patients, and we're going to think today about just generally managing psychological well-being when you have a diagnosis of PSC. So the first thing is, don't panic. Lots of people have an idea that when there is somewhere a perfect patient who gets a diagnosis of chronic health condition or is told they need something like a liver transplant, and there's somebody that copes absolutely perfectly, never feels emotional, never feels overwhelmed, and just gets on with things without a murmur. I have yet to meet that person. So yes, the first thing I want to say is if you feel overwhelmed at any point during your PSC journey, it's often a normal response to what you're going through. The next thing I want to say as well is most people cope without needing formal psychological support. Difficult emotions are a normal part of adapting to your diagnosis. And most people, it may be hard and difficult, but will get by without needing formal psychological support. And I'm going to talk a little bit in a minute about the context of why people struggle psychologically, because there's many reasons why people struggle, and people tend to feel it's their fault, and it's absolutely not. There are many factors that feed into why it is challenging to have PSC. So this is, I apologize ahead of time for a really terrible diagram. As you can see, my computer skills are poor, but I hope that you will get the general picture. This is demonstrating how people generally adapt to difficult news or difficult events in their life. And the big red squiggle is the event, the bad event that happens, which I've put here, you getting a PSC diagnosis, though it could just as equally be an increase in symptoms of your PSC, a hospital admission, being told you need a transplant, all those things that happen along the journey. And there's time along the bottom showing the progress of time. There should also be horizontal axis that I have omitted, which is sort of generally showing this is your sort of well-being. So you're trotting along with your well-being, okay, and then you get this horrible diagnosis and told you have a chronic health condition of PSC. And what tends to happen to people, and again, this is a generalization, you may not go through all these stages, or you may go through them quickly or not at all. But generally what happens is people say they initially feel a bit numb and in shock. They can't believe it's happened to them. And some people say they don't feel anything at all. They just don't know what to feel. Sometimes then people's mood goes up a little bit and they go into denial. They can think, well, this is all wrong. They've got the wrong results. It's not really happening. Somebody's going to tell me this is all a horrible mistake. And then generally what happens is when we're coming to terms with these things, our mood goes down. It sort of slowly plummets, and people can have a whole mixture of emotions, feeling angry, sad, confused, anxious, lots of challenging emotions before it sort of bottoms out at the bottom where I've put despondent and low mood. And the whole time that this is going on, people feel utterly preoccupied, thinking about their illness, the future, what does this mean? And eventually, when it sort of bottoms out, your mood will start coming up, and eventually you reach a place of accepting, okay, I've got PSC, what, how am I going to cope with this now? How long this takes can be dependent on many things, and different people will go through the process in different time frames. And very few people are able to have their diagnosis and then just swiftly move on and accept it. It's, as human beings, we are meaning-making beings, and we need to make sense of difficult events, and hence we need to make sense of what does our diagnosis mean to us in terms of our life going forward, and hence we have almost to grieve the life we thought we were going to have before we can get on and approach the life we are going to have with PSC. And that's what this sort of adaptation process is. It's a way of coming to terms with a big change in life. And yes, if you have questions at the end, please bring them back. And but this is generally what we as humans have to go through in order to come to terms with things. And as I said, this may happen at various times along your journey. And it's also to bear in mind, this may happen to your loved ones as well. They have to come to terms with illness and the changes along the way, and what that means for the future. And what can complicate it is you may have come to terms with your diagnosis and those around you have not, or vice versa, and it can cause challenges in relationships, and generally in life going forward. So that is how we adapt. I just want to reference the wonderful research that PSC charity does, and this is back from a 2016 research that you did into what was important to patients, but it feels very relevant. I don't think it's changed over time, that the most difficult parts of living with PSC came out as the uncertainty, helplessness, and concern about treatment and future. And as you can see along the side, the percentages of people that felt this, 60% of people found managing the uncertainty had a huge emotional impact on them. They felt helpless in terms of PSC and the symptom burden it was having on them, and concerned about treatment, diagnosis, frequency of interventions and medicines. So it's not unusual I really want to stress that having an emotional response to this is not an unusual thing, but it's often, as Paula said, it's I think underestimated the emotional impact it can have on patients by clinicians that are very focused on the physical aspects of the illness. So why are there challenges? And I just put chronic illness here because we know with PSC that there can be other illnesses that go alongside it. People can have other gastrointestinal problems, sometimes diabetes, other chronic illnesses. And again, I want to put this in context as to why there are psychological issues. There's the clinical aspects of managing illness, attending hospital appointments. Sometimes people have never had to go to hospitals regularly, and suddenly with PSC, this becomes part of your life. Taking medication regularly, again, if it's not been part of your life previously, that can take a lot of adapting to, and can feel intrusive and unwanted. We know the symptoms of PSC are challenging, the pain, fatigue, and the itch all are challenging symptoms to manage, and can be difficult to address physiologically. Often the solutions delivered by the medical team don't fully address the symptom, and of course that leaves a psychological burden on people. As I've said, there can be other comorbidities that go along with having PSC. Hospital admissions can be incredibly challenging. The procedures you have to go through that can be invasive and traumatic, and also learning about this new condition. You can be given a lot of information that can feel very overwhelming, and it can be very medically based, which can be a challenge to understand. So there's all the clinical aspects of that. Plus, there can be socioeconomic aspects of having PSC. If work gets impacted and that impacts your income, that brings going forward, having to arrange your life around hospital appointments, about seeing clinicians. And this can have knock-on effects to childcare, social life. And again, it's putting everything in context. Often people think, and those around you have very sometimes lay people understanding of illness, and it can be very simplistic, like, oh, you've got PSC, well, what are they going to do about that? How are they going to manage that? And other people may not understand the entirety of what is impacting you. I've then put in the psychosocial impact of chronic illness, and there is a huge list here, and I'm not, for the sake of time, because I'm aware we've got slightly late because of my IT problems, going to go through all these individually, but it can have a huge impact on life going forward. We've talked about work, education, finances, ambitions, future plans. Being told you have a chronic illness, as I said, it can change how you perceive your future. We often have an idea of how life is going to look going forward, and suddenly you're faced with, gosh, it might be slightly different now. And that takes time to come to terms with your identity. What am I now? Now I am someone with PSC. Does that change? Self-esteem, stress levels can go up hugely managing all this. Body image, that can change how we see ourselves. Again, with the symptoms, can change our body, and when our body changes, how we feel in relation to that. And all the other things around us, relationships, friendships, family, sex life, coming to terms with functional limitations, all these, loss of control, all impact how we feel psychologically. I put loss of control. It's interesting, I put it at the bottom, because it can be right up at the front. Suddenly life becomes determined by how you feel, and it can be very easy to feel that you've lost control when you come into the NHS. You're at the mercy of other people, be that doctors, nurses, where timing of interventions, it can feel things slip out of your control. So there's many reasons why people feel unsettled at many times in your illness journey. The emotional impact, managing your own changing emotions can be difficult, and we've been through how we as humans respond to changing events. Coping with others' reactions. There can be judgments of others, especially if you tell them you have a liver disease. There can be all sorts of assumptions. If you tell people you need a transplant, there can be assumptions about, well, you must be a drinker, and that can feel very stigmatizing. And yes, other people can have very different views of illness to what you know the reality is, and that is something additional to cope with. People can feel guilty for being unwell, feel a burden to their family. They feel people feel they change within themselves, which can make them feel guilty. I will also add in here, we are a society that does not deal well with people being chronically unwell. There is an assumption that the norm is not to be unwell, to be working full time, and not to be stressed and anxious. And I would say that's entirely unreasonable. We have whole hospitals full of people who are unwell. So there is a impact on people with chronic illness and uncertainty about the future. I'm aware of time, and I'm going to romp through the end bits quickly because I could talk all day, and that's not going to be helpful because you've probably got lots of questions. So then we think about coping, and coping can be unconscious coping. We can have flight or fight responses when we're scared, or it can be sort of conscious, considered thinking what to do. And when we think about coping strategies, they can be problem-focused or emotion-focused. And problem-focused strategies are the ones when we think, what's going to help? You know, okay, I'm going to go and do some exercise because that helps me manage information about my disease. I need to learn new skills to cope with my disease, or perhaps new skills to help me manage stress. So it's a sort of very proactive way of addressing difficulties. Emotion-focused coping, again, can be very helpful when we're seeking emotional support from our support network, thinking of meditation, distraction. I've put downward comparisons. Sometimes people think, you know, there's always somebody worse off, and that helps people cope with their emotions. There can also be some unhelpful emotion-focused coping strategies as people who stay in denial or use drugs and alcohol to manage difficult emotions. So those are the general sort of coping strategies we think about. When we think about managing stress, it's sometimes helpful to think about ourselves as a bucket, and we constantly have stress flowing into our bucket because life is stressful. We cannot avoid stress. But if you are managing a chronic illness, already your bucket is going to be at least half, if not 3/4 full. So you don't have as much room for the ordinary everyday stresses on top. So often your bucket may start overflowing sooner than others because you just have less room. And when our bucket overflows, it's a sign we need to do something. We can get snappy with others, irritable, feel overwhelmed. And the way to manage stress is to think of having a tap at the bottom of your bucket, and good coping is ways of letting that stress out. So things like using your social network, you having some exercise, enjoyable activities, stress reduction strategies. But if you don't have any of those, or you're using bad coping strategies, your bucket doesn't empty. You need to think a little bit harder if you're coping with chronic illness, as I say, because your bucket is fuller than most people's. I am going to skip over this, but it's just showing how thoughts can affect feelings and behaviours. But in terms of time, I am going to, I can come back to it if people want, but I'm going to just miss that one. What I want to say when you're thinking about coping with illness, if you think about ACE, so you think things that are going to help you manage are, you want things that give you a sense of achievement. That can be work, that can be learning a new skill, it can be anything that gives you, you know, sometimes connecting with your family can give you a sense of achievement. Sometimes it's even just something as simple as doing the hoovering, but you need part of that in your life. You need to connect to others. We are social beings and we need to connect to others, and we need some enjoyment in our lives, activities that give us enjoyment. So when you're thinking about how am I going to cope, it's making sure you're covering all these areas in your life, which I know can be easier said than done when you have a chronic illness, but it is important. So, reiterating this, we are social beings. We need to connect to others. You need to think, who's in my social network? Who's there to support me? So making sure you have people around you that, as much as possible, that you can rely on and that support you. You might have a lovely support network, but you need to use it. I'm a psychologist, I would say this, but you need to talk to other people. Often a lot of our issues, we can ruminate on them, they can go round and round in our head, but the old saying, you know, a worry shared is a worry halved, a problem shared, problem halved, really can be true. Talking to others and getting another perspective on it can be really helpful. So use your social network. Rest and relaxation. I often use this picture, and people that have been to my talks when I came and spoke at the conference will recognize this. Things that help you relax, that help you feel you can let go, are important. And that will be different things for different people. Some people find exercise helps. Other people like massage, sitting in front of the television, watching something enjoyable, a good bath, anything that gets you in a place that you feel relaxed is helpful. And apologies for this, I have granddaughters and I am fully immersed in all things Frozen, but the saying, let it go, recognizing some things are not in your control. And often a lot of our difficulties is when we are trying to control things that are not in our control, i.e. worrying about what's going to happen in the future. Am I going to need a transplant? Am I going to need a hospital admission? These things are not in our control, and trying to let these things go can be really helpful. Again, I'm just emphasizing this, managing uncertainty, trying to let go of the things we can't control in the future, keeping your focus on today can be really helpful with chronic health conditions. Rest and relaxation, and reminding yourself, we all have the illusion we know what's going to happen tomorrow. Reality is we don't. We have no idea what's going to happen in the next 5 minutes, let alone in the future. So we do cope with uncertainty all the time. But I think with chronic health, we can find it really difficult because we get hooked on, I just don't know what's going to happen with my disease. But reminding us that we cope with this all the time. Oh, wrong way. I finish on this. It's a thing they say in Alcoholics Anonymous: learn to accept the things I can't change, the courage to change the things I can, and the wisdom to know the difference. Often the things we try to change or try to control are the things we have no control over. Going wrong. I presume you're going to get these slides. This is about just where to go if you want to get some more help, but that may come up in the questions anyway. So apologise for racing through that because of my IT problems. But that is what I wanted to say as an introduction, and I will stop sharing these now.
Thank you very much, Lucy. Thank you very much for that introduction to the subject. I forgot to say at the beginning in my introduction that if anybody has a question, please put it in the Q&A section on the webinar, and we will come to those questions. But I have had a few up front before the webinar has taken place, and you talked a little bit right at the end there about how you can get referred to some mental health services. Is there a best route for that? Is it better to go through your GP so they have a record of it, or is it best just to go ahead and self-refer or to speak to your liver consultant?
I don't think there is a best route. They are all options. If you're living in England, you will have access to an NHS talking therapy service that you can refer yourself into. And if you just put in where you live and NHS talking therapies and Google it, you should come up with your local one, or go onto the NHS website therapies, and then there's a link you can go into there to find your local service. All of these talking therapy services you can self-refer either online or on the telephone, or by email, I think. So that is one option. Speaking to your GP, they will be able to refer you if you don't want to do it yourself. You can speak to your liver consultant and see if they have access to psychology. Some services have access via, they'll have a health psychology department that they can access services, though I will say it is very patchy. Some teams will have access, others won't, because it's all dependent on how the individual trusts fund their services, and some will fund psychology, some won't. And yes, I'm trying to think if there's another, there isn't really any other option. So the Liver Transplant Trust can sometimes direct people into services as well. And that's, yes, that's it. But all the your local talking therapy service should have a chronic health conditions arm of the service that you should be able to be referred into to get support.
And I suppose there is that private route if people have got that.
There is, and yes, I don't like to mention that because I know it's not an option for all and it is expensive, but if there is always that. And there are various websites. The British Psychological Society have a list of psychologists that you can look up your area and psychologists that are registered with them. There is, there is one for psychotherapists, which is called there's either the BACP or there is a UKCP one, I think, that will have, these are people that are registered with them and you know that they've got some kind of qualification behind them.
And there will be people who are specialists in chronic health conditions in those areas as well, will there?
Yes, and you should be able to search for them on the various websites. I know on the BPS one, you can search for psychologists that work with health conditions. And I think you can do that on the UK, I think it's UKCP, which is United Kingdom Counsellors and Psychotherapists website as well. So yes, there will be people out there.
Okay, thank you for that. Somebody's asked, and are you given some simple steps that people can take, things that people can do to help themselves or to better manage the psychological impact of PSC? Is there anything else? Questionnaires, exercise, maybe some apps. Is there anything else that you would advise?
Exercise is always good. You're on a win-win situation with that because it helps physiologically, but it also helps psychologically. All the research shows that regular exercise is good for people psychologically. It helps in stress management. It helps people it helps with sleep, which can often be disturbed when you've got a chronic health condition. And it just helps people sort of calm their minds. And the exercise can be anything. It's whatever suits you. And again, there is never a one size fits all. Some people love going to the gym, other people don't. It can be team sports, it can be running, it can be swimming, walking, anything. Exercise is good. In terms of apps, I don't know any that are, now I've mentioned sleep, there is one called Sleepio, which is Sleepio, that is, I think you can now get access via the NHS for free, that has had lots of research that helps with sleep, and we'll talk you through strategies to manage that. There are various meditation ones that I think all come at a cost. There may be versions you can access for free, but if you want the extra bits, and if you go on, again, on the NHS website, they will suggest various apps, and I cannot remember the names of the ones, but I know they're on the NHS website.
I can try and dig those out, and we can include them in the notes when we post this to YouTube.
Yep, that's fine. And yes, in terms of strategy, it is that keeping up your social contact, keeping enjoyable activities in your life, because often those are the first that get let go when people are with chronic illness, and we all need things we enjoy, and keeping a sense of some meaningful activity, whatever that may be, can be helpful.
Okay, thank you very much for that. There's this question here. The graph you showed in the beginning,
A very bad one.
the person said, I feel like I'm on this roller coaster, but I don't believe I think about my condition at all. Could I be feeling all these things without ruminating on the condition unconsciously, they ask?
Yes, I think that it's never what I presented is a generalization. There's always going to be different bits, people are going to respond differently. And yes, you could be feeling all the emotions and not thinking about your condition at all. And whether that's helpful or unhelpful really depends on personal circumstances, because I'm thinking if you're feeling it all and not thinking about your condition, there might be a bit of a disconnect if that's what's causing all these difficult emotions, and there may be a degree of denial. But for some people, it's helpful not to think about their condition and just to plow on. But I would say, yes, you can feel all those and not consciously be thinking about your condition.
And I guess some people could go through a period where they don't think about it, but then go through periods where they do think about it.
Absolutely. And I think coming to terms with something and coping is never a nice linear sort of diagonal line. We have ups and downs the whole time, and it can be forwards, backwards, and different things going on around your, if you're having a very stressful time at work or in your family, this of course is going to impact how you feel about your condition and how you're coming to terms with things. If there's a change in your condition, of course, that's going to bring about psychological changes. It's variable the whole time.
Yeah, and that's one of the things I thought about when you were speaking. You said most people don't need intervention. They don't need that psychological support. They cope with it on their own. But one of the things that kind of I thought about at that point was, for a lot of people, there might be a relationship breakdown, a house move, a divorce, money problems. There are so many things that we
Yeah.
cope with in life anyway, that if they come on top of, just
It
being
just tips everything over. Yeah.
yeah.
No, absolutely. Those big life events that, again, you can't avoid and can't predict. Yeah. Going back to the bucket analogy, those kind of things will fill your bucket up even more. And you have chronic health condition, then top it off with a bereavement or something. Yeah. It's going to be challenging.
We have a question from a parent. So the question is this: any advice as a parent of a child with PSC? She was I'm saying she, the child. It doesn't say she. The child was diagnosed at 6 with IBD and 7 with PSC. Oh, she is now 8, so she does say she. And while she's getting psychological support, the daughter, it feels like our support as parents has gone on to the back burner.
And I will say, I should have said at the beginning, I deal with adults. I don't have expertise in children. I'm glad to hear that child is getting psychological support. And I know often the support for children and children's services can sometimes be better than it is for adults. It can be better funded. But yes, I know the funding to support families is not there. The places I refer patients, British Liver Trust do some support groups that can be helpful. Places like yourself, I would refer people to PSC Support, because I know you do wonderful work in supporting people.
Sorry to interrupt, but we have a helpline with a nurse who works with liver patients, but also has PSC herself. So she very much knows about the clinical side, but also how to cope with the condition herself. So just to say that.
And those kind of things are invaluable. And I would say, if parents are really struggling, refer yourself to the NHS Talking Therapy Service. There is support out there. There might be a wait to get it, but there is support out there. I'm trying to think of anywhere else. And again, our PSC support, I think, is so helpful, because getting support from peers or other people that are going through this similar things can be really helpful. And I don't know whether you put people in touch. I'm just thinking off the top of my head, but actually that can be, because you can feel very lonely when you feel, because it is a rare condition. And yeah.
And that's one of the things we kind of pride ourselves on, the Facebook group, which is a peer support group. And we know that people have met up from that Facebook group. So there's some mothers in Scotland of children, most of them are adult children actually, but children with PSC, and they meet for a coffee every couple of months, and they gain a lot from that kind of support network that they've got. So I think that support network is really important. I know that people come to the information days to meet other parents, or meet other people with PSC, because I think that is invaluable. I remember, I think it was last year when we went to Manchester, one of the sort of lovely stories from that event was 2 mothers met at that event, and they were mothers of 17-year-old boys, I think 17 and 18, something like that, but they were very similar in age. And the boys didn't want to know about PSC. I want to live my life, forget that, I want to just get on with things, which is understandable. And the mums were, you know, trying to get all the information and deal with it. And they stayed in touch after the event and have just gained a lot of strength, I think, from being in touch with each other. So I would encourage anybody to either come to those events or join our Facebook group as well. I've got another question here from somebody who said that their mood always dips following hospital appointments or calls. How can they better prepare myself for those? It's almost as if I'm in denial leading up to the appointments and then the reality hits all over again, she says.
Well, number one, I would say I don't think they will be alone in getting anxious about appointments and mood dipping afterwards. I wonder if they're a bit just reminding it or telling him herself that actually it's okay to feel anxious about it and it's okay to have a mood dip afterwards, because I wonder if there's some, whatever it is you're told, there's another sort of process of accepting whatever you're told at that time. And I would also say, if your mood is dipping after every appointment, what are you doing after every appointment? Is there a way to do something different? You know, give yourself, it sounds like appointments are quite stressful and difficult. Do you give yourself a treat after that? Is there something you can do that, you know, reward yourself for going through this stressful experience, which you have no control over, you have to do, but you deserve a treat, whatever that may be, which might help mood. And another, yes, just, I would, again, coming back to my perfect patient, I wonder if talking to other people, if they have similar experiences. I certainly know a lot of people get very anxious about appointments and what are they going to say and what's it going to mean this time, and a feeling of dread, and acknowledging that this is okay. And again, how am I going to look after myself in this situation? What's going to help and support me? What do I need to do in terms of perhaps distracting myself pre-appointment, and trying not to predict what's going to be said, and just turn up and accept that I can cope with what I'm being told in the moment. Because lots of people will do a lot of, well, what if they say this, and what if they say that, and what if, and you prepare for every scenario, and then actually when you get there, it's something completely different you haven't even thought of anyway. And allowing that actually I can cope with the unexpected, and will, again, that old saying, we'll cross that bridge when we come to it, and try and distract yourself until that point. I don't know whether I've answered the question, but without knowing the specifics, because I suspect there's many different reasons as to why people feel that way. But it's not an unreasonable response to medical appointments.
Okay, thank you very much for that. We've had a couple of questions actually about people who cannot have, for whatever reason, cannot have another transplant. Is there any services out there, I presume you're one of them, to help people when they're told no to another transplant?
And that's really hard. That is because that has implications for your life going forward. And that's, yes, certainly in our service, I would be there to support people with that. But I know we are very lucky in having that facility, and not every service has it. Again, it would be going to your local team and saying, I need some support, where can you suggest? Sometimes if you're not being offered another transplant and care is going to become palliative, sometimes palliative care can be very good and very helpful. Again, going back to your local talking therapy service, and I'm sorry that this is the only place I can suggest when I don't know individual circumstances, but there is always that service. or asking, again, going to your GP, seeing if there's any local health psychology input. But there is no doubt when you're told you can't have another transplant, and that has implications for your symptoms going forward and your life span, that is a big thing to come to terms with, and lots of people need additional support at that time.
And you might not know the answer to this, Lucy, and that's fine. But are there any routes of appeal if you've been told you're not going to have another transplant?
Now, I know you can probably ask for a second opinion. And I know teams, if it's something to do with the criteria, it depends on the criteria you've been turned down on. So if it's sort of, teams can appeal if it's something physiological or to do with your blood results or something like that. They can put an appeal out to NHSBT, the people that regulate transplant. And I'm sorry, that's slightly vague, but I do know that their teams can appeal if you fit a certain set of criteria, of which I couldn't give you the details with any confidence. And you should be able to ask, I know certainly for first transplant, if you're turned down, you can ask for a second opinion. I think second transplant, no, yes, you can. Sorry, I'm just thinking on my feet because we've had a similar circumstance. You can ask for a second opinion. So your details will be sent to another transplant team who will give their opinion about whether they will offer you a transplant.
Okay, thank you very much for that. Just a few comments really. We often see that people with PSC are first told they have it in a very mentally challenging way. So this links in with another question that, a diagnosis of cancer is generally given face to face with follow-up support. And with PSC, it can be bad news by letter, no support, which causes huge psychological trauma. Is there anything that we can do as an organisation to potentially help fix that? Any suggestions?
I feel very sad when I hear that because being given any diagnosis by a letter or where you don't have an opportunity to ask questions and is not ideal for sure. I'm thinking you as an organisation, I suppose it's raising awareness that this is not helpful to people. I would say anybody that's got it by letter is going back to the consultant and say, I need, asking for another appointment so you can ask questions, or asking to speak to a clinical nurse specialist or somebody who can answer your questions, because I agree entirely, being given the news that way is not helpful. That said, sometimes being told face to face, people can come away and think, oh gosh, I wish I'd asked X, Y, Z, because when you get the news, you are just in shock and cannot take in the information. Without knowing the rationale the individual services are using for that, it's hard to know why they would choose that way to give the information. I would hope that any service that's sort of psychologically informed would not do that. But again, it's a rare illness, and we know that some, as you say, cancer is very well funded, has very good advocacy, and PSC Support does great work, but it's so much smaller, it's hard to get the same coverage.
And we are working jointly with others on the best clinical pathway for somebody with PSC. So we are hoping to have an impact on that in the future. So we are doing things in that respect as well. A couple of final questions. Somebody's asked, what's NHSBT? It's the NHS Blood and Transplant Service, dealing with all things blood and transplantation. Just to answer that. And somebody else said that they are in the same situation with that parent, and they have a parents to a 4-year-old with PSC. So please feel free to reach out, and they've given their email address, which is, if you can't see it, then I can send it out later to that person, that individual. Thank you very much for offering that support. Last question. When it comes to considering work and career, should we plan ahead and be realistic? In my case, I could change tack for a more active job so that I'm in a better position when the conditions worsen as I get older, although this is not something I would want to do. We can't know the future. With chronic conditions, should we be planning for the likely outcome rather than worrying about it and if and when it happens? And that's going to have to be the last question.
So they're asking whether they should plan their life around what might happen?
Yes, I think so, yes. We can't know the future, but with chronic conditions, should we be planning for the likely outcome rather than just worrying about it?
I would say a bit, if you can, again, it's hard to know, because I would say get on with life as normal, as much as you can. Obviously, there is a little pragmatism in that when you have a chronic health condition, and there is an awareness it may deteriorate. But again, unless you've been given sort of definitive, this is going to happen in a few months, you know, it could stay stable for a long time, and then you could miss out on opportunities. This is a very waffly psychological answer, but I would say living like, you know, staying in the present, living as much as you can now, and trying not to predict the future with a little bit of pragmatism. I mean, depending on what your job is, and you know it's going to be impossible to carry on and I can't think of a job. Yeah, I don't know what that job might be. But employers, you know, they have a duty to make reasonable adjustments for chronic health conditions, and it shouldn't stand in the way of you doing what you want to do.
Yeah.
Again, I'm aware that's a very vague answer. Again, without knowing the specific, it's really hard to.
Yes, but I have heard doctors say, live your life. What do I do now? The question is, live your life. You know, we do know of people who've lived with PSC for 20, 30 years without any major issues. Obviously, there are some issues, but without any major issues. So putting off having a family, for instance, not having a family, you know, those sorts of things, if they'd have not done something, then they would have missed that opportunity to do it potentially. So I think that really is very good advice. And with that, it's 1 o'clock. So thank you so much, Dr. Lucy Gorvin, for that session.
Oh, thank you for asking me.
And we can certainly put those that information about where to find psychological support if people need it. We can certainly put that on the YouTube video, and I don't know if we can send it out to participants after the event, but we will try and do that as well. But if anybody needs that information again, please contact me, Paula, at pscsupport.org.uk, and I'll get that sent to you as soon as possible. But thank you so much, Dr. Gorvin.
Absolute pleasure.
I really appreciate your time today. Thank you so much, everyone, for joining us today.